Set up a measure to evaluate care gaps. Let's follow Harriet Randall, the Salesforce admin at Bloomington Caregivers, as she sets up a clinical measure for hypertension evaluation. Harriet stores the measure metrics in 4 measure objects. You'll shortly see how these objects relate to the evaluation process. She refers to the hypertension HEDIS measure to assess care gaps among patients whose blood pressure levels are outside the recommended threshold. Harriet defines the measure in the clinical measure record. The measure has specific criteria that provide a standardized framework to evaluate care gaps. Harriet creates a clinical measure criteria record for each criterion. She then groups the criteria by using the clinical measure criteria group record. If required, Harriet can dig deeper into the outcomes by defining multiple stratification criteria. Next, let's understand how measure criteria are used as conditions in a rules engine. The business rules engine evaluates patient records against the criteria. To do this, the engine uses custom logic that works as if-then statements and deems the care gap outcome as excluded, closed, or open. A care gap is excluded as soon as one of the criteria in the first expression set is not met. When the status is excluded, there's no further evaluation. If a patient meets all the criteria, the rules engine assesses criteria from the second expression set and determines if the care gap status is open or closed. Let's see how Harriet sets up these criteria as conditions by using a business rules engine's component called expression sets. Harriet creates 2 expression sets. The first set ascertains the patient's age and sequentially checks the measure conditions. If the evaluation doesn't meet any condition, the care gap status is excluded. If all conditions are true, there is a second round of evaluation. The second expression set checks the patient's blood pressure range to determine if the care gap is open and requires next steps, or if it's closed. Next, Harriet tests the second expression set using a built-in simulation tool. Harriet reviews the output status in the tool's main panel and confirms that the setup meets her requirements. But her work isn't done. Salesforce still needs to evaluate patient records based on the expression sets, so Harriet creates 2 flows. The first flow gets the patient's data, such as date of birth and hypertension health condition, and passes it to the first expression set, which then evaluates if the care gap is excluded. If it's not excluded, the flow invokes the second expression set, which checks for open and closed statuses. Based on the output, the flow updates the care gap status on the care gap record. In the case of a stratified measure, as an output of the evaluation, the flow records the stratification of patients in the care gap criteria results object. Now, Harriet must decide how to trigger the first flow for evaluation, so she creates a parent record-triggered flow that initiates the evaluation flow. Harriet has successfully set up the care gap evaluation for hypertension. Now, she can similarly configure evaluations for each clinical measure that Bloomington Caregivers tracks. When Harriet's work is done, care coordinators can create care gaps by evaluating clinical measures. They can address open care gaps by identifying the next best action, such as personalized interventions or administering assessments, to create a care plan for the patient. To learn more, check out these resources, or join us on the trail at trailblazer.salesforce.com.